My name is Dr. Christopher Spagnuola. I'm one of the orthopedic surgeons here at Seaview Orthopaedics. We have the pleasure today of speaking to one of my patients, Tracey, who is a marathon runner, and I'll let Tracey tell you a little bit about herself.
Hi, I am a 44-year-old married mother of 3 boys, Jack, Connor, and Ryan. I work full-time in New York and commute anywhere from 3 to 4 hours a day depending on traffic, and I love to run marathons, raising money for causes that are important to me.
The first time I met Tracey was back in April of last year, and she had a very significant injury to her hip. It started after she was running the Boston Marathon, and I'll let you, Tracey, tell you about her experience that she had with her hip injury.
Yep, so I was about 3 weeks away from the start of the 2016 Boston Marathon, and I was starting my taper down of my runs, and I started to have what was pretty significant groin pain on my left side, and I kind of just brushed it off as something muscular and didn't really want to honestly admit that there was an issue because I was so close to race day. And so I was determined to get to that start line, so kind of just took those last 3 weeks and didn't run. I mean, it hurt to walk. So I figured, all right, just don't do anything really for 3 weeks and get to that start line and see what happens. And I got there, and about a mile in, I knew I was kind of going to be having some issues. About 6 miles in, I realized those issues were going to be pretty significant. I kind of got myself to the halfway point and realized I was definitely in some significant trouble. And I called home from the course, called my running coach, called some friends, and everyone's advice was get off the course, go to a med tent. And for me, that really wasn't an option because it was a Boston Marathon. You don't really get off the course in Boston. I knew if I could get to 20, I had family there that could help me, and so I made it, hobbled my way to the 20-mile mark, and at that point as a marathoner, your mindset kind of is that you only have 6 more to go, so the damage is already done, might as well just finish what you started. So unfortunately for me, fortunately I made it to the finish line, but unfortunately I pretty much collapsed right there and was dragged off to the med tent and put in an ambulance to Mass General, which is ironically the organization I was raising money for that year. I was raising money for their emergency medicine department, and here I am in their ER with what ended up being a significant hip injury, and I knew I wanted to get home. I wasn't able to go home for a few days. They needed to stabilize me there. They kept me there 4 days and then released me to come back to New Jersey to follow up, and that's how I ended up in your hands.
Well, that's very commendable, running a marathon, let alone finishing in such pain. So, Trace, that's an impressive story. And I remember when I met you last April, how distraught you were to be a runner, not being able to run and having so much hip pain. And your desire was to continue running it back to marathon. So we wanted to lay out a plan that would hasten your recovery. So our first line of treatment, how did we start initially?
Well, you were very conservative at first, which, for me, I was kind of, all right, well, if you're going to do surgery, let's just get it over with. And you're like, no, we were going to just see, obviously as a surgeon, you only want to go in when medically necessary. So I'm a very impatient person, so the whole just stay off your feet, just don't do anything didn't really settle very well at the beginning. But I kind of took it day by day, so it was a very conservative treatment at first. But for me, I kind of knew, just even hobbling around the house, that there was something definitely not quite right here. So I think I was persistent in calling back and saying, I need to come see you again, and I don't know what's going on. And my gut instinct was saying, there's something more going on in here.
So initially we tried to let the hip rest, stay off of it, and try a period of non-surgical treatment. But unfortunately, as Tracey said, the pain persisted and worsened, and we repeated an MRI locally, and we saw a significant stress fracture that was more apparent than the first MRI. So at that point, we had to talk about surgical management for Tracey's hip, which is a big undertaking, especially in a runner. We were able to perform a minimally invasive surgery to fix the stress fracture in her hip, and Tracey will tell you about some of the rehab afterwards.
Yes, so beginning when you told me, I think it was a Wednesday morning, well, we are going to operate and it's going to be tomorrow morning. I think that pretty much sent me over the edge, because even though I had originally wanted to go in and have surgery, I think, okay, you're going on an operating table tomorrow morning, did not settle right with me at all. And to only have 24 hours to prepare is probably the best thing, actually. I didn't have to think about it too much. But yeah, I was really nervous going in terms of just any concern that I think any of your patients had, I had, and then some, and times that by 1,000 as a mom with 3 little boys and a commute to New York and, you know, running for various causes, and like I had to kind of give up all of my trust to you. I'm a very type A personality and a little bit of a control freak, so that was a little hard to do at first, but showed up for surgery and it went really well. And I remember waking up in, you know, the recovery room and like, okay, well, it's done. All right, gonna be back out running again. And I did get back out running again. It wasn't right away, and I think part of my recovery process was learning to be very patient, because recovering from any surgery, whatever it may be, is a process, and it isn't necessarily a straight linear process forward. There's definitely some few steps forward, few steps back, and I experienced a lot of those.
So after Tracey's hip surgery, we let her walk on her hip basically right away, although it was painful. She needed some crutches. She recovered very well, and I saw her 4 months after the surgery, and for her 4-month follow-up, she told me she had just ran 6 miles. And that was pretty impressive after coming off a major hip surgery and the significant pain she had after the marathon. But I was glad to see she was back underway. And where have you gone since then, Tracey? It's been about a year now.
Yeah, it's been a really exciting year. Let's see, that 6 miles turned into 7, 8, 9, 10, 11, 12, and this past April, so not even a year to the surgery date, so 11 months after surgery, I ran the Jersey Shore half marathon, and I actually had my best time ever in a half marathon with hardware in my hip. Go figure. So when I had the confidence then, that built a lot of confidence that, okay, those 13 miles, I can potentially do the marathon again. Because we had talked about, you know, you always said, you'll run again. The question was whether or not I would continue to run distance and run these marathons again, because everybody's body's different. And, you know, for me in the back of my head, I'm like, if I'm going to run again, I'm going to run marathons. And so that Jersey Shore half gave me the confidence to get back out into distance running, and I'm there, and I've been training over the summer, and I'm going to be running the Chicago Marathon in less than 2 weeks, and then New York 3 weeks after that.
I think that's very impressive. Yeah. Good luck to you, and I believe you have a charity you're running for Chicago?
I am. I'm running for pancreatic cancer research, and it's a cause that's very special to me, and really it's going to be my comeback marathon, and to be doing it for pancreatic cancer it means the world to me, so it's going to be a very special day, and I can't thank you enough, Dr. Spagnuola, because you took exceptionally good care of me. You're incredibly patient with me. I don't think I was the easiest of patients, and I thank you from the bottom of my heart.
Tracey, it's been my pleasure. Good luck with the Chicago,
Thank
running
you.
for yourself and all the others, and good luck in the future.
Thank you.